कितने दिन लगेंगे?
प्रिंस, दिन में एक से ज्यादा बिजली का शॉक किसी इंसान को नहीं दिया जा सकता है। कोई कोई आदमी ऐसे भी होते हैं जो एक शॉक से ही अपनी याददाश्त खो बैठते हैं, और कोई कोई ऐसे भी होते हैं जिन्हें 6 शॉक तक देने पड़ते हैं।
यानी 6 दिनों के अंदर तुम यकीन दिलाते हो कि विनय अपनी जिंदगी की हर बात भूल जाएगा?
क्या बात करते हैं, उसे तो अपना नाम तक याद नहीं रहेगा।
गुड।
This is a popular concept of the electroconvulsive therapy, or the shock treatment as it is commonly called. Thanks to our films, we can only think of this treatment as something to be dreaded and as a means of torture at the hands of crooked villains. But we should not really blame the films. The electroconvulsive therapy in the initial period was used rather indiscriminately and thus came into disrepute. The treatment has come a long way since the time it was first discovered in 1934. A physician named La von Meduna observed that schizophrenic patients who had epilepsy improved after they had had a convulsion. He therefore concluded that there was an inverse relationship between psychosis and epilepsy. He then started inducing seizures in schizophrenic patients by using camphor. Later he replaced camphor with another chemical.
This method had its problems. There was no way to monitor and control the seizure once it started. Safety was another problem.
In the meanwhile, 2 Italian physicians, Serletti and Bini, noticed that electric current also could induce seizures. In 1938, they came up with electroconvulsive therapy, which was safer, reliable, and could be monitored more easily. This therapy is called direct ECT.
Its main side effect was that the patient would have fractures of long bones and spine due to convulsions. The patient would also have unpleasant memories of the time before the procedure started. The discovery of anesthesia brought about a revolution in this field. The modified ECT, which is administered today, is a treatment made much safer by the use of anesthesia and muscle relaxant. Moreover, ECT is now administered only in certain conditions.
चिडचिड करत होते, गप बसत होते, पुन्हा रागत होते, कुणाकडे पाहून हसत होते. त्रास म्हणजे त्याच्यामध्ये काय त्रास होत होते की ती काही सांगत नव्हते. दाटपडी गोळ्या गेला की जास्त चिडायचं, मारहाण करायचं, दुसऱ्यावर यायचं अंगावर, असं काही त्यांचा त्रास होता. त्याचं ठीक झाले सर.
ECT or electroconvulsive therapy is a very effective and safe treatment. In cases of severe depression, it is extremely effective and it can even have a life-saving role. So the depressed patients who are suicidal, who are refusing to take food, who are very retarded, they respond very well to this treatment. It is also useful in other psychotic conditions, and it can be used in a range of age groups, various age groups it can be useful. It is so safe that the safety can be compared to that of the risk involved in giving a B-complex injection.
It is mandatory to obtain an informed consent of a relative of the patient.
सूर्यवंशी बाबा तुमची मुलगी आहे ना संगीता तर तिला आज आम्ही ECT देणार आहोत ECT देतो म्हणजे अगोदर एक इंजेक्शन देऊन तिला भूल दिली जाईल आणि त्याच्यानंतर मग तिला काही समजणार नाही तेव्हा तिच्या डोक्याला एक अशी पट्टी लावली जाईल C आकाराची अशी पट्टी असते आणि ती पट्टी लावल्यानंतर थोडासा विद्युत प्रवाह सुरू केला जाईल आणि त्यामुळे तिच्या मेंदूमध्ये ज्या पेशी आहे त्या पेशीमध्ये काही रासायनिक बदल घडतील आणि ते रासायनिक बदल झाले की त्यामुळे हा आजार लवकर बरा व्हायला मदत होईल तर त्यामध्ये तुम्ही घाबरण्यासारखं असं काही नाही आहे आम्ही रात्री सांगितल्याप्रमाणे तिला काही खायला प्यायला दिलेलं नाही आहे ना तुम्ही सकाळी गोळ्या दिल्यात का सकाळी चहा पाजलाय का तिला काही नाही ना मग आता तुम्ही तिला ECT देण्यासाठी तयार आहात अशी सही करा इकडे इथं लिहिलेलं आहे मी माझ्या स्वतःच्या जबाबदारीवर कोणत्याही भूलेखाली माझ्या मुलीला ECTची ट्रीटमेंट देऊन घेण्यासाठी मी तयार आहे त्यातील कुठल्याही सर्व धोक्याची मला कल्पना दिलेली आहे त्याबद्दल माझी काही तक्रार नाही आता इथे तुम्ही सही करा या ठिकाणी इथे करा हो करा चालेल
The day before ECT is administered, the patient undergoes a complete checkup. The patient's relative is instructed about the do's and don'ts.
उद्या सकाळी की नाही आपण रोहिदासला ECT देणार आहोत रात्री जेवण झाल्यानंतर आम्ही तुम्हाला गोळ्या आणून देऊ त्या गोळ्या झाल्यानंतर मात्र त्याला काही सकाळी परत द्यायचं नाही आहे किंवा रात्रीतूनही काही द्यायचं नाही आहे नंतर बिडी तंबाखू सिगरेट काही द्यायचं नाही
त्याने जर मागितलं तर मग
मागितलं तरी नाही द्यायचं रोहिदास मागायचंच नाहीस तू मग ठीक आहे कारण भूल देऊन करायचं आहे ना तर त्यामुळे तुला काही न खाता पिता तुला राहावं लागणार आहे आणि
त्याने जर चुकून घेतलं तर काय करायचं
हां चुकून घेतलंच ना तर लगेच आमच्या लक्षात आणून द्या आम्हाला सांगा कारण भूल देऊन करणार ना मग त्यामध्ये एखाद्या त्याला त्रास होण्याची शक्यता आहे तर त्याने घेतलंच तर मग आपण काय करणार की ECT देणार नाही एक दिवस नंतर देऊ आपण त्यात काही विशेष नुकसान होणार नाही आहे पण खाल्लेलं लपून ठेवायचं नाही आहे
The patient is first given anesthesia and then a muscle relaxant. This produces profound relaxation of all muscles, thus minimizing the risk of fractures. At the same time, the patient is administered 100% oxygen. The blood pressure cuff is tied to the arm and air pressure elevated above blood pressure so that circulation is stopped and muscle relaxant doesn't enter the arm. This makes it easy to see and monitor the seizure. The patient's pulse, oxygen saturation and cardiac status is constantly monitored. After this, electrodes are placed at specific points on the temples of the patient and electric stimulus is given. It induces a seizure which usually lasts for 25 to 40 seconds. But the seizure is not seen as a fit all over the body because of the muscle relaxant, but twitches are seen only in the arm isolated by blood pressure cuff. Later, the patient is shifted to the recovery room where he is continuously monitored. The patient regains full consciousness within half an hour and can be given food 2 hours after the procedure is complete. The same procedure can be repeated 2 or 3 times a week if necessary. What exactly happens when a patient is administered ECT? Our brain consists of millions of nerve cells. These cells communicate with each other with the help of chemicals called neurotransmitters. Neurotransmitters play an extremely important role in the functioning of the brain. Neurochemical research has shown that changes occur in neurotransmitter activity following ECT. These changes are similar to those which occur after antidepressant medication. The scene of what happens in the brain after ECT can be aptly compared with a traffic situation. First, there is chaos, disorder, and therefore a traffic jam. Then comes the traffic police. He stops all the traffic for a minute and establishes order. The electroencephalograph recording of the patient reveals the same scene. Here is a recording of pre-ECT electrical activity in the brain. When the ECT is administered, there are changes in this activity. These are recordings during convulsions. Then comes the period when the electrical activity is almost at a halt. When it resumes, the functioning of the neurotransmitters is expected to be better, which is reflected in the behavior of the patient. The whole procedure is now made almost 100% safe by the use of latest instruments. The EEG machine makes it possible to actually see the intensity and duration of convulsions. Without EEG, seizure duration is underestimated many a time, leading to unnecessary repetition of treatment, which may mean more side effects. The EEG machine helps the doctor to decide if the patient needs to be administered ECT again at the same time, and also to terminate a seizure if it has continued for more than 2 minutes. The pulse oximeter displays the pulse rate and oxygen saturation of the patient, so it can be monitored constantly. The cardiac monitor displays the status of the heart during this procedure. It has a defibrillator attached to it, which can be charged within a few seconds. The defibrillator is used to give a direct shock to the heart to revive it, in case the patient should have a cardiac arrest. The electroconvulsive therapy unit itself has passed through many stages. What you see here is a unit which was used till about 30 years ago. This unit here was used till 10 years before and is still used today in some clinics. Both these units are called sine wave machines. They give continuous current of a particular voltage which was administered for about 1 to 1.5 seconds. The latest unit is called a brief pulse machine. It gives less than 1/3 of current given by sine wave machine. The brief pulse machine gives out current in pulses, and the patient gets very brief pulses of 1,000th part of a second. Thus, the patient gets a minimum dose and all the risks and side effects are minimized.
Well, there are some side effects, but they are not serious. The patient may suffer occasionally from loss of memory for a short while. Also, when the patient wakes up after the ACT, he may be little confused at times and may have headache and body ache. But all these side effects are absolutely temporary and there is no permanent brain damage. ECT is not administered to patients who have major health problems like uncontrolled hypertension. Careful monitoring is also necessary if there is any respiratory or heart problem. Electroconvulsive therapy is now a well-established scientific method of treating mental disorders. So the next time you watch one of those gory scenes in any film, just remember that the reality of science is something else.